So we're going to talk about oligoprogression. So what is oligoprogression? Well, oligoprogression is a new concept. And, in medicine, we like to make things complicated. So oligo means few or little. And progressive disease is a disease that's growing after initial treatment. So oligoprogressive is a few sites of the disease are growing after initial treatment, okay? And this is a relative new concept because before we saw disease progression as a concept that was affecting, it was black or white. It was disease progression or no disease progression. But now we have this middle point called oligoprogressive disease, which is disease growing in a few sites of metastasis in a patient that otherwise has a stage 4 or widespread disease. And it's very important that we are conscious about the language that we use, and is the patients do not progress, their cancer progress, because our patients are more than the disease, and the disease doesn't define them. So this is oligoprogression or the cancer. The patient, there is no patient oligoprogress, it's the disease. Then we need to make sure we use patient-inclusive language. So I use this diagram because it really helps understand several concepts. And they all start with the word oligo, which means few. So we have patients that have de novo. It means at the moment of diagnosis, they have oligometastatic disease. It means the disease travel from the lung to another site, compared to other patients that may present with cancer in many, many organs, right? And we have oligopersistent. What is oligopersistent? It's a patient that has some disease and some limited sites, and when it's treated, only 1 or 2 sites remain. And what we're talking about today is oligoprogression, in which the patient has limited disease, receives treatment, and after a certain time, 1 or 2 sites of the disease grow where the rest of the body or the rest of the disease is under control. So why do some patients have disease progression in many organs, and why some others only have disease progression in some limited numbers? So one example is a patient that has widespread disease. They get treated with TKIs or the targeted therapy, and then they have a good response for around 6 to 9 months. And then a site in the liver or a site in the bone starts growing. So that is oligoprogression. The rest of the body is under control, but 1 or 2 sites are growing. So it is a complex concept that we're trying to understand why does exist. And there's several factors that affect oligoprogression. One, we know that when we are targeting a specific mutation with these new drugs, the cancer evolves and develops resistant mechanisms. And so that's one of the reasons we see oligoprogression, because a part of the cancer has developed a resistant mechanism to the targeted therapy. Another is changes in the tumor microenvironment. You see this most in patients that are treated with immunotherapy or immune checkpoint inhibitors or the pembrolizumab, nivolumab, or those drugs. Also, there's several hemodynamic patterns because we see oligoprogression more common in some organs that have high blood supply, like the liver. A lot of patients tend to have disease progression in highly vascularized organs. And that means there's more blood going, there's a pattern there. Also, what areas have been previously treated with radiation and ablation or surgery? Those areas are less likely to have disease progression compared to areas that have not. And also the unique disease characteristics. Lung cancer is no longer one disease, it's many different types of mutations. And we know that certain mutation-specific cancers like to go to certain organs more than others. One example is the ALK-positive non-small cell lung cancer that has a preference for the brain.